Hello and Assalamu alaikum. Ultrascan Diagnostics. The video report for your patient that you had requested, the area of interest is highlighted as the lower anterior teeth. This is the panoramic view. We can see that there is periodontal disease in the lower anteriors, and that periodontal disease is compromising from between mesial of the lower left canine to the mesial of the lower right canine. Now, on a transaxial view, which is basically the proximal aspect of the teeth, we will show you one by one. The lower right canine looks something like this. So we've got a lower right canine which has minimal bone support on the buccal aspect. We'll zoom in for our kind doctor. There is minimal bone support, and we see PDL widening and periodontally compromised tooth. Moving to the mesial aspect, we see that there is a radiolucency associated with the lower right canine. On the mesial aspect, we don't see any signs of cracks or fractures on this view. We will look for it on the other views. Moving to the lower right lateral incisor. The lower right lateral incisor has adequate bone support. We do see PDL widening, but we don't see any major periapical radiolucencies, and we see absolutely sclerotic canals in this region. The lower right lateral incisor has very sclerotic canals, and there is very little that we can see, a very faint canal right here, but it does seem to be absolutely sclerotic. Moving to the central incisor, the central incisor seems to have very minimal bone support. There is periodontal disease, PDL widening, and again in the central incisor, it seems to us that there is a very limited and very sclerotic canals. Now moving to the central incisor on our left side, the central incisor right there. Sorry, just reorient it for you. There we go. So the central incisor on this region also has very faint canals present right here. It does seem to be periodontally compromised. We've got minimal bone support on the buccal and as well as on the lingual side. Moving to the lateral incisor, you see that the lateral incisor has adequate bone support, but this lateral incisor seems to be very sclerotic as well. This is very interesting. This is probably one of the first cases we've seen that has all of the lower incisors absolutely sclerotic. Moving to the lower right canine, here you can see that we have adequate anatomy in the canine. The canine has wonderful bone support, and we don't see any major periodontal disease associated with the canine. However, we do see this punched out lesion right next to the lateral incisor and the canine in the lower left region. Now we'll show you the teeth from a transaxial view. There we go, that's the transaxial view. Sorry, this is the axial view only, and just going to zoom in for our doctor. So this is the lower anterior region. In this region, you will be able to appreciate the bone support and the fact that we cannot see any major canal morphology in the lower right canine. The central incisors do not show any signs of canal morphology or the pulp chamber whatsoever, which is absolutely astonishing. We can see that there is minimal bone support associated with the incisors. Here you can see that there is bone loss around the incisors. The canine on the lower left region seems appropriate, whereas the canine on the lower right region also has bone support, but we do not see, and we see periodontally compromised canine in the lower right region. We've got bone loss cortical hair, bone loss buccal cortical hair, bone loss around the central incisors. So it does seem to have very significant bone loss. This is the lower right canine. We don't see canal morphology here. We do see it in the lower left canine, but absolutely no canal morphology can be discernible in the CBCT, and this is at 150 micrometers of slice size. If you have any, we have a periodontally compromised tooth in the lower left first molar region. So if you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.